Teresa Kazayeva just for a few words on what this report contains. Thank you.
Thank you very much. Dr. Tedros presented excellent summary of the main findings of the report, but I would like to add few more things. So this year report is not just a release of the new latest data and overview of the global and country situation on tuberculosis. It's also a highlight WHO's unwavering commitments to continue leading efforts and fight against major epidemics such as TB, HIV, viral hepatitis, malaria, and others. And here you will be able to find also important information and lessons learned from the experience in many countries, as well as important information on the funding situation, real-time data based on monthly monitoring of TB notification, how funding cuts can influence access to essential services, as well as overview of the latest WHO guidelines and the pipeline of new diagnostic, new medicines, and even vaccines. TB response was managed for many years in the situation of the chronic underfunding, and further cuts could be really catastrophic for TB response and can lead to the increase in mortality. These gains are really hard-won gains, as Dr. Tedros highlighted, and we should do our best and increase domestic and all other types of funding to sustain TB response. That's why we are looking very much with the hope for the forthcoming global fund replenishment, and for international partners and donors are stepping in. We have very good examples in more than 100 countries that managed to decrease TB incidence at least by 20%, and more than 65 countries decreased TB mortality by 35%. It highlights that progress is possible. From the century-old disease, it can become successful story, and we have very good opportunities. Please follow WHO guidelines and latest recommendation, and it will make difference for the lives of the millions of people around the world. Thank you.
Thank you very much, Dr. Kazayeva. With this, we now. No, first of all, the report and the press release you can find online now on our website. And with this, we open the round of questions. And the first is Gabrielle Emmanuel from NPR. Gabrielle, please go ahead and unmute.
Hi, thank you so much for doing this, as always. It's really helpful. I wanted to follow up on the mention of tobacco harm reduction and see if you could respond to some of the criticism that the WHO has not fully engaged in the scientific debate around harm reduction and the reducing combustible tobacco, and some evidence that does show this reduction can have health benefits and can be a way for not for new smokers, but for people who are already smoking to get off of combustible cigarettes. Thank you very much.
Thank you very much, Gabrielle. And we turn to Dr. Ben McGrady. He's the unit head of the Tobacco Free Initiative here at WHO.
Thanks very much. And just to clarify, actually, head of the public health law work on tobacco control, and my colleague Vinayak Prasad, who heads the Tobacco Free Initiative, can't be here today. Thanks very much for the question. I think it's important, first of all, when we consider tobacco control and this question around combustibles, to think about the bigger picture of where we are on tobacco control. Dr. Tedros mentioned that it's 20 years since the Framework Convention on Tobacco Control came into force. And in that 20 years, with strong regulation of tobacco products, we've seen enormous public health gains. We've seen a 27% relative reduction in tobacco use globally since 2010. So when we look at tobacco control, we need to look at the big picture and we need to know what's working. And the evidence shows that over a sustained period of time, strong regulations to reduce demand and supply for tobacco products is having a massive impact on public health, and that impact is a huge public health success. With respect to so-called non-combustible tobacco products, and we're speaking here about a range of different product categories, it's important to recognise that we cannot generalise about the health risks posed by these tobacco products for the world at large. Even within smaller product categories like electronic cigarettes or heated tobacco products, the risks posed by individual products are not the same. We see huge variation within product categories. We see huge variation in terms of how the products are used, how the products are manipulated before use. And so it's not responsible to simply generalise for the world at large about the health risks associated with different products. What we're stressing in the position that we are releasing today is that governments should regulate all categories of tobacco, nicotine and related products to a common minimal level. This means implementing proven tobacco control measures like health warnings, like taxation, like prohibiting advertising, promotion and sponsorship for all categories of products. This is essential to ensure that when we look at the population at large and the health of the population at large, these products do not lead to a new generation of addicts, nicotine and tobacco addicts, and a new generation and wave of health harms. It's essential that these measures are put in place across all product categories to protect public health. Thank you.
Thank you very much, Ben. Yeah, quick reminder, because apparently a couple of journalists have not identified them with themselves with their outlet. So please do that, your full name and outlet, in case you want to jump online and ask a question. Otherwise, we cannot take you. Thank you very much. Second question goes to AFP, Robin Millar. Robin, please go ahead.
Thank you. On the tobacco industry and those attempts to, as you put it, infiltrate and undermine the convention's work, could you